Hello, everyone. Welcome. It's a great pleasure to welcome you to this abstract writing webinar designed to support you to write successful abstracts for the INSU 2025 conference. We're joined by a phenomenal faculty who's going to be speaking to us today. But before we introduce them, I thought it might be a good idea to introduce you to INSU for those of you who are less familiar with the organization. So we are the International Network on Health and Hepatitis in Substance Users. We're a not-for-profit global member-based organization designed to support the health and well-being of people who use drugs. We work in three core pillars of activity: knowledge exchange, education and training, and advocacy. And our core activity under the knowledge exchange pillar is our annual conference, which we hold in a different city each year and brings together researchers, healthcare practitioners, policymakers, and a community of people with living and lived experience of drug use. And we are incredibly excited to be coming to Cape Town this year in October. There's lots of ways that you can get involved with INSU, of course, submitting an abstract. We also have a scholarship program. If that is of interest to you, please do look at that on the website as well. Same deadline as the abstract, so 2nd of March for both your abstract and your scholarship submissions. Just to note that to have an accepted scholarship, you must also have an accepted abstract. Aside from the conference, you can also become an INSU member. So that will give you discounted rates for the conference and also lots of member-only content and events. It's free for people with lived experience and for students and for postdocs. One element of our membership is also our wonderful early mid-career researchers special interest group, who are a group of researchers from around the world who come together to deliver really fantastic capacity building activities for early mid-career researchers. So if that's of interest to you, please do look on the website or reach out to us and we can link you in with that group. So our speakers today are, like I said, some fantastic speakers and core members of our network. So Professor Jason Grebely, who is president of INSU and head of the Hepatitis C and Drug Use Group at the Kirby Institute, UNSW Sydney. And so he's going to be speaking to us about general abstract process for the conference and a particular deep dive on the epidemiology track. We have Scientia Professor Carla Treloar, also from UNSW at the Center for Social Research in Health and Social Policy. And she's going to be speaking to us about social science abstract submissions. And Dr. Andrew Scheibe, also an INSU board member and technical advisor at TB HIV Care and researcher at the University of Pretoria, who will be discussing model of care abstract submissions. So this is a brief overview of what we're going to cover. So some basics of what is an abstract, what to think about when we're submitting, what reviewers are looking for, how they're scored, and then, as I said, going into all of those different tracks. So epidemiology, public health and clinical research submissions, social science submissions, model care submissions. We are also going to have some time for some Q&A at the end of the session. Some brief housekeeping points. So please do keep your cameras off and your microphones muted just to minimize any distractions. But do use the chat box if you have any questions. If you see a question in the chat box that you like, please give it a thumbs up and we'll try and prioritize those ones. If we don't get to all of the questions, we will be putting together a frequently asked question document, which will circulate with the recording of the webinar. Last note from me, just to draw your attention to AI when you're writing your abstracts. Look, we understand that AI is a really useful tool and is ever present in our lives. We don't forbid use of AI when you're writing your abstracts, but we do ask you to declare if you've used it. And please do be sure not to use AI just to generate your content from scratch. You can use it to refine your original content, to tidy up grammar, edit it down, but don't use it to create something from scratch. And please do check anything that you get from AI for accuracy. And I'll now hand over to Professor Jason Grebely, who will be speaking to us about the epidemiology, public health and clinical research track. Thank you, Jason.
Awesome. Thanks so much, Emma. Lovely to see everybody from all over the world. So a couple things. We're gonna start off a bit. I think we thought we'd start from sort of the very basics. And for some of you, what is an abstract? It really provides the readers a summary and encouraging to read on. Provides reviewers with a crude indicator of the value and the quality of work. And an abstract may only include findings that are part of a smaller project. So that's some basics. But I think there's a bunch of things that we want to get through today. So I'm going to kind of run through it here. We're going to give you a little bit about how to prepare your abstract for submission, some general guidance on abstract writing, a little bit about key components of a successful abstract, a little bit about understanding the scoring criteria, particularly for the INSU conference, thinking through what is a reviewer actually looking for, and trying to maybe get inside the head of a reviewer when they're scoring these. A little bit about some common pitfalls and perhaps how to avoid them. Okay, so the first thing I want to say is that some of the stuff that I'm going to say today is personal preference, but I think there are some rules that sort of can be used by people. So I think there's a couple things though to think about before you even submit your abstract and before you sort of put pen to paper. I think the first thing is this conference a good fit for the proposed content? So I think really, if the conference is about point of care testing and that's the focus of the conference, you shouldn't submit something about cardiovascular disease that has nothing to do with point of care. So I think, is this the right home for my work? I think another thing that's really critical is when's the deadline and do I have enough time to prepare the analyses? We often have a late breaker call. And so if today is not the right time, think about, well, do you have a little bit more time? And also ensuring that you have enough time to circulate it to your other co-authors. I think you really need to ask yourself, is your analysis ready for presentation? And again, do you have that time to circulate to the co-authors so that they all have time to review? It's pretty frustrating to receive an abstract the day before the conference is, the deadline that you're given by somebody. And the other thing is have the authors sort of reviewed this work before, or are they the first time they're seeing it? So, if this is the second conference that this work has been presented at, it's a little bit easier to just send sort of a, hey, FYI, this is pretty similar to what you saw before, versus, having to this is the first time that this group is seeing these results. And then if you're a PhD student, I think it's really important, have you discussed this with your supervisor? What's the deal? Often when you submit an abstract, there's some sort of, and if you get an oral presentation, there is some, expectation that you have had that discussion. And I think asking permission to submit something is often also asking for permission for the funding to go to that conference. So just think about that. All right. I think it's really hard when you first sort of pull up a blank Word document and it's, so, starting to write is not easy, even for the best of us. I often will work off of a template of something previously to get my sort of head going and to get a little bit of a format. And so if I think about where did I learn to write abstracts, I really enjoyed traveling and going to conferences early career days. And so I really tried to make it to as many conferences as possible. But my mentors, I had a great PhD mentor who's a great writer. And another place is actually the Strobe and Consort guidelines. To be fair, I probably use those a little bit more for paper writing, but there is some useful tips in there around what to include in an abstract, which I'll share with you in a second. But I really would suggest that if you are new to writing papers, that you do go to these best practice guidelines. There's one for social science, there's one for health economics, because they're really like instruction manuals for writing papers. The other thing you can do is, I think, go to the top tier journals in the field. So for hepatitis, go to Lancet Gastroenterology and Hepatology, see how, they've got a great team of editors there. And so, they're able to kind of pull the content together. It's a very structured way. So go and see how things are done there. And it'll often give you a good indication of how things should be done. All right. So we're going to work through some examples. This is actually from the Strobe guidelines. This actually explains, so this is kind of how the guidance is sort of organized. So for example, provide in the abstract an informative and balanced summary of what was done and what was found. And you can sort of see here that gives you an explanation. So the abstract provides key information that enables the reader to understand a study and decide whether to read the article. Typical components include a statement of the research question, a short description of the methods, results, and a conclusion. Abstract should summarize key details of studies and should only present information that is provided in the article. And then they provide some further guidance. So I think it's really useful. If you've never gone to those, please have a look at them. Okay, so the first thing to do when submitting a conference abstract to the INHSU conference is go to the website and read the abstract submission guidelines. Do not prepare your abstract until you've done that. It's really important because every conference is different, how it organizes things, and so I think it really helps you. So read them carefully. The other thing that's important is sometimes each type of abstract area has a different template. So please, for INHSU, go out, have a look. What's the epidemiology and public health and clinical research template? If that's what you're submitting to, click that. That's different to the models of care version. Okay, so make sure you do that. The next thing you need to do is make a decision about your theme. So which track are you in? Look, this is, sometimes it's difficult for people, but, and this information is all on the INHSU website. So, INHSU welcomes submission of abstracts and workshop proposals for original contribution to the field. We encourage submissions that highlight specific characteristics or subpopulations and are from low and middle income country settings, and even more important in Cape Town, given the conference is going to be there. So epidemiology and public health research. So this is abstracts that present research on social, cultural, environmental, occupational, and economic factors that determine health for people who use drugs. Clinical research. Abstracts present research that seek to improve the prevention, diagnosis, and treatment of disease and injury in people who inject or use drugs. Social science policy, empirical or non-empirical studies that focus on social, structural, cultural, material, and policy contexts. And then lastly, the models of care. So real world examples of innovative models of care, programs, or interventions to enhance healthcare delivery for people who use drugs. Okay, so now you've decided. So I'm going to cover the section on epidemiology, public health, and clinical research. So I'm assuming you've gone to that, you've checked that. I think a couple of things about abstracts. So they're going to be favored at the review time if they're original data of high quality. I think that's really important. An analysis that extends existing knowledge. So repeating things. We treated 20 people with, sofosbuvir valproatosphere or the glycaprisvir preventasphere. Those studies will be much different, much less received than something that's looking at some brand new intervention to enhance testing and treatment for Hep C that we've never seen before. Also, in terms of it's really showcasing something innovative, a model of care that's really new, something that we haven't seen, It's really important. Every abstract is reviewed by 3 independent peer reviewers. So it's a really objective process. We really, in the scoring and ranking, we really try to keep to that. And then here's your criteria. So you watch these, and when you're writing your abstract, am I doing this? So first of all, the background and clarity of objectives of the study, the appropriateness of the study design and methodology, the appropriateness of the study results, and the conclusions and significance of the contribution. You get a score out of 5. Then make sure that you download the correct abstract submission template. So that you're doing that. And then and then make sure that you look at your preparation guidelines. So again, background, this is how it's organized for the epidemiology of public health and clinical research, your methods, your results, and then your conclusion. Okay, and I'm going to run through each one of these so that you get a bit of an indication of kind of what we're looking for here. All right, so sorry, I chose one of mine. It got kind of highly ranked in the last year's submissions. And I also picked another one from Adelina Artini, just because it highlights a couple of different ways of doing things. Again, there's no absolute right way to do it, but there's certain components that you want to keep consistent. Okay, so background, what are people looking for? This is really your chance to kind of highlight, why is this important and what were the aims of what you did? So it needs a description of the problem or the study rationale. So why do I care? What is the gap in research that we're trying to address here? And then So try to limit this section to only 2 or 3 sentences. It doesn't need to be 6 sentences to kind of make that point. Probably a sentence or two on why is this important, and you're foreshadowing to like, why do I care, plus how is this study going to fill a gap in our knowledge? Okay. So the first thing, why is this important? Place the research in context. What's the gap in the literature? And then in the second or third sentence, and this is critical, so many of the abstracts don't do this, clearly state the aim or the objective of your research. All right. So I'll give you 2 examples from these abstracts I selected. Okay, so the background says fingerstick point of care testing enables diagnosis and treatment in a single visit, increases testing acceptability, and reduces loss to follow up. Okay, so we know immediately that this is what this abstract is going to be about. So this is why this is important. And then the second sentence is this analysis evaluated HCV testing, RNA prevalence, and treatment uptake in a national program to scale up point of care HCV testing. So again, what were the study aims? So really clear 2 sentences. Another way that you can do it is sort of what's the gap in knowledge. So in the abstract by Adelina, data are limited on the number of new annual HCV infections attributed to injecting drug use. Immediately, we know what this is going to be about. Well, this is the problem, is that data is limited. So I'm now thinking, okay, the next sentence is going to be about what they're going to actually do. So we estimated at country, regional, global levels, HCV incidence in people who inject drugs and the number of new annual HCV infections attributed to injecting drug use using multiple methods and data. Super clear. I know exactly what this paper is going to do. Probably, you'll score that a 4 or a 5. And I'll actually go to the scoring. So what are we looking for? And it's clearly articulated on the website, but so a score of 5 is that the background rationale is exceptionally clear, the research is novel, and fulfills a significant gap in the literature, and there's a very clearly stated objective. So that's what you're looking for. So you go back to your abstract. Does my abstract do this? If not, it's probably sitting at one of these other. So it's either the background is very clear, background rationale is clear, background rationale is stated. So again, if you're not getting 5s, it's because it's not exceptionally clear and novel and very clearly stated objective. Okay. Okay, next section, methods. What did you do? So this is really, okay, the method employed or the approach taken. Again, consider the same key things that you would include in a paper. Describe the study setting, study design. What is the study design? Is it a prospective cohort? Is it a clinical trial, randomized controlled trial? And then clearly describe the recruitment setting. Is it in drug treatment clinics? Is it needle syringe programs? Describe the inclusion criteria. How were people, entered into the study? Describe the procedures and data collection methods. So, what surveys did you do? Or what information did you collect? And I think it's really important to clearly define any of your outcomes. So we evaluated testing and treatment, blah, blah, blah. And then describe the methods for any analysis undertaken. Okay, so let's go through another example. So this is, oh, sorry. So here we go. So through an observational study design is noted. The National Australian HCV point of care testing program is evaluating the scale up of point of care testing at 90 sites in Australia, including drug treatment clinics, blah, 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 blah. The program facilitates point of care testing for anyone at risk of HCV or attending a service providing care for people at risk of HCV. So the study design is noted, the setting, recruitment setting, and the inclusion criteria. The program also includes standardized operator training for non-laboratory staff and a quality assurance framework. RNA testing is performed in settings with high HCV antibody prevalence and so forth. And HCV antibody testing with reflex RNA testing is performed in settings with low antibody prevalence. Okay, so then that clearly you can see the procedures, data collection, and outcomes there. All right, let's have a look at Adelina's. So another example, so first we estimated HCV incidence using force of infection modeling based on HCV antibody prevalence stratified by injecting duration from 79 studies. Second, we used previously published estimates of HCV incidence from our global systematic review. dynamic mathematical model of HCV epidemics. Third, we predicted HCV incidence. So really clear here about everything that they're doing in the study. You know exactly the methods that are being used. Okay, so what about the methods? What are we looking for? So again, the methods are exceptionally a 5, exceptionally clear. Study design and methodology are entirely appropriate to evaluate the stated objectives, and the statistical analysis are entirely appropriate. So again, you really want to be, is this the right thing? If it was a, randomized controlled trial, it's, again, what, depending on the suitability of the study is, or what's required in terms of methodology. And you'll see similar things, as you go down, and probably as you deduct points as you move down the list. Okay, results. What did you find? So in summarized form, so it must include data, but don't include a table because those are not allowable. You can also have one graph or figure. So you want to describe the study population. So, you want to know, jet proportion female, age, proportion injecting, thinking about the stuff that is relevant to your study, and ensuring that you present that information, proportion recent injecting, so on and so forth. You then want to describe the key outcomes of interest. You would have defined those in your method, so then you really want to focus on those. And then you want to clearly explain the main findings. And statements should really be backed up by data. Just sort of throwaway lines, we found X, Y, and Z without sort of some data to support it. So again, here's another example. So between January 2022 and March 2023, 59 sites have been established in 5 states, territories, with 8,027 point of care tests performed, with 2,484 people tested in the community and 4,754 in prison. Among those receiving HCV RNA testing, 992 people, or 14%, have current infection, within the different proportions in the community and prison. Among the evaluable population, HCV treatment uptake is 86% overall, including those results in the prison and community. So really clear, what's being investigated and those primary outcomes. Here's another example from Adelina. So we produced 195 HCV incidence estimates from 105 countries, representing 88% of the global people inject drugs population. The US, UK, and China had the highest numbers of estimates, and then providing the incidence, and then the numbers of new infections, and then the largest number of new infections, and they're highlighting certain countries. So again, really, really clear and presenting the results. Not too many, well, you could say maybe too many numbers, but it's really clear. So I actually don't mind sort of the numbers that are in there. Okay, how is this scored? So excellent. So the results are well presented, do an excellent job at supporting the aims, objectives of the study, and provide very novel findings. So again, these are the things that get you a 5, and then the rest gets you below that. Okay, last thing is conclusions. So summary of the key findings and the implications. So this is really important. Try not to overstretch. This is a brief description of the main outcomes of the study. So summarizing things, and sort of, include sort of knowledge or insight that conference attendees may gain from the presentation, and perhaps this is kind of added value stuff that you could have. But I think it's important. A lot of times people think that a conclusion section is an interpretation section. It's not. It's a conclusion section. So it should be backed up by data, and really try not to overreach your findings. So again, for example, a conclusion: on-site point of care testing has led to high treatment uptake across Australia, particularly in prison settings. Standardized operator training and quality assurance delivery and management have been critical for test performance. Or this example from Adelina: injecting drug use contributes substantially to incident HCV infections globally. Findings emphasize the importance of scaling up prevention and treatment strategies for people who inject drugs. But you can see, really short. This isn't going on for multiple sentences, on and on and on. So again, the conclusions scoring. So the conclusions are exceptionally well presented and well supported by the findings. And the work is an excellent contribution to evidence-based knowledge in the field. All right. And then again, if not a 5 are those. Okay. So just a couple of insights into a reviewer. What am I thinking when I'm reviewing these? So I'm looking at these abstracts. I got 15, 20 of them. What's going through my head? So the first thing is this work novel? And what does it add to what we already know? So if this is just another study looking at Hep C treatment outcomes in people who inject drugs, seen that before, lots, it's not going to be scored as highly as some, like I said, some intervention which we've never seen before. Have the authors clearly defined what the aims and objectives are. This is kind of a number one mistake, is that somebody will provide some big long background but not actually state their aim or objective in the beginning bit. Have the authors use the most appropriate methodology to answer the study question. So I think that's really important. And yeah, are the results clearly presented, and do they support the study question? And again, what limitations are there in these work? And those tend to get points deducted from the score, I guess, when I'm scoring. And then just in general, is the abstract well presented? Formatting, attention to detail. I hate bullet points within the abstract. It should all read as a continuous thread within each section. But like, if you don't pay attention to detail in your abstract, inconsistencies in formatting, different font sizes, it just shows that you probably haven't paid that level of attention to the work and the research that you've done. So it's just a red flag. And then I'm thinking, is this a poster, a short oral, or a full oral? So do they need the full amount of time, do you figure? Is this really novel? Is this just the messaging can kind of be, said in 5 minutes? And this is what we're given for the abstract rating. So you're scoring him like that, but then at a reflection, you're kind of saying, oh, how does this fit into this? Is this rapid fire score of about 15? So if you're scoring like 3s on each, that's like 12. So that's a poster. If you're up to like the 4s, it's kind of like, is it a short oral or an oral? And if it's all 5s, then you're kind of like, well, this is sort of plenary presentation where everybody should see this because it's important to everyone. Okay, so just a couple common pitfalls to avoid. We see it all the time. Do not have a super long background section. You kind of lose the reader quickly. So 2 to 3 sentences, like I said. Don't forget to include the specific aim objective in the background. Again, you'll get points deducted. And don't forget to include information on the study design. So what was the study design type? And really ensure that you describe the key outcomes that you're measuring. I see it all the time as well. But try not to make sweeping statements without having supporting data. So it's really important to back those things up. And again, don't pay attention to detail. This stuff really matters. So don't skip it. And I think one thing that to note is that authors, you really need to make sure you give the same attention and effort to each section of the abstract. Oftentimes we'll see it where you see, oh, this is a really well-written results section, but then people didn't spend much time on the background or the conclusions, and you're just like, oh my God, you just gave away points. This would have been, a full oral or a short oral, but it's not because the time wasn't taken, their attention wasn't taken. Just a couple other things to think about. Again, is now the right time to submit? So if you have abstracts that have preliminary data or without data, just don't submit it. Wait for the late breaker. You'll get like scored so poorly. We say results will be presented at the conference. No, just wait till the late breaker when you have results and then put them in. Should I wait for the late breaker deadline? I think you should think about it. If it's not quite ready, don't rush your co-authors, don't rush yourself. Just wait a couple of months. And because the way the late breakers work is they don't supersede the scores from the previously submitted work, but they allow you to, if it's ranked, at least if the score is higher than the other abstracts that were submitted in the general section, they'll get up. So we get this a lot. Well, should I submit it to the clinical track or should I submit it to the model of care? Look, I think it depends. If it's programmatic work, it often fits better in the model of care section. Whereas if it's kind of a pure research clinical trial, it sort of sits better in the clinical section. So I think, have a look at the guidelines and you need to judge based on your individual work, which one it sort of best fits into. The other thing is just really make sure that you submit to the right section. A lot of times we'll get people submitting social sciences in the public health and epi, and we have way more abstracts in the public health and epi section. So you're disadvantaging yourself because we try and keep it, when we select the abstracts, we really try to ensure that there's a breadth of content. You only have 300 words. So I think you really need to carefully consider the most important things to include. And so really top line information, don't try and include everything, just include the most important stuff. but also don't sacrifice your background and conclusion and pay attention to everything. And I think, the litmus test is a bit, can someone who's not in this area clearly understand the results? And that's kind of know that you've communicated things well. Text or figure, it depends. If you can clearly articulate something, then include a figure. But it depends. I think it's got to really make a good point. Otherwise, then you're spending time trying to explain what the figure has to say. All right, so I think that's about it me for time. It's my pleasure to hand over to my friend and colleague Carla Treloar, who's going to give us a little bit of insights into nuances around social science abstracts.
Thanks, Jason. And hello, everybody. Greetings from Sydney. I'm on the lands of the Indigenous Bidjigal people, and I pay respects to First Nations people around the world who've been dispossessed from their culture, their land, their language. So I'm going to talk a little bit about social science abstracts, and the points that Jason has made above really hold. We're looking for quality. We want well expressed, well put together social science as abstracts. What we're really looking for, though, that will put you up in the scores is some conceptual framing, particularly for papers about using qualitative research. There are lots of thematic, descriptive abstracts that are submitted, and they're not the highest quality. What we're looking for is the use of ideas and concepts, because that allows you to connect your work to other bodies of literature that are also using those concepts and theories and framing. So I've also taken a highly scored abstract from last time, and we're looking at the same sort of things, a well-structured introduction that gives you a couple of sentences of background to set the scene, as Jason has explained. And what I'm really looking for in reviewing qualitative abstracts is this last bit of the method. So this last sentence. In particular, we look at the intersection of nostalgia, structural vulnerability, and collective grief. So there are three fantastic ideas to look for in how this holds together across the abstract, that there's some coherence about why those three ideas would be tagged in the introduction as something important, how the methods were used to interrogate those three ideas, how the results firm up these three ideas, what did we find out about the intersections of nostalgia, structural vulnerability, and collective grief. And then in the conclusions, where does this propel our understandings and scholarship around this topic using these ideas? For social science, that's it. That's what we're looking for. Some ideas, some theories, some conceptual framework, and all of the explanation Jason has given about what makes a quality abstract holds. While I've got the floor, I wanted to go on to a slightly different topic, but as it's an ethical obligation, I think, for us to talk about and think clearly and carefully about the language that we use in our academic writing. So I've pulled out a couple of papers here that might be useful for people to reflect on. This first one published in IJDP by our fantastic colleagues led by Kate Sear. And what they're telling us is that in our research and in our writing, we make up the reality of the world. We just don't document it. We are making it together in our writing. So it's an ethical project for us to think about the language that we use. So it's important, very important in the issues around drug use and people who use drugs, because this sits within a very large, long-standing international legal framework that refers to the use of drugs, the possession of drugs, as a serious evil. And that's exceptional language, exceptional terminology that's not used in any other international conventions, including those such as on genocide. So that language has set the entire history of our research. We have all grown up in the era era of the war on drugs. And so we need to understand what we can do to balance out, use very careful language that doesn't accidentally even reframe or continue to frame drugs and people who use them as evil, and to understand how criminalization impacts our understandings and the research that we do. So we have, just to give you a little bit of data to back this up, in our own setting in Australia, and we would expect this to be holding across the world, when we ask people who inject drugs what they've done to avoid being treated negatively by health services, we have large proportions of people saying they've not told health workers about their drug use, they have delayed accessing healthcare, they've not attended a follow-up appointment, they've downplayed the need for pain relief, and they've looked for different services. So this is where our decisions about the language we use in research come to exert or be part of very important choices that people who use drugs make in avoiding healthcare, because it is also structured by the language that is informed by this notion of evil. So this isn't the we're not the only sector who's thinking about our language. This is the NASA, the US Space Agency, rethinking the names that it gives to cosmic objects, because they have used lazy, culturally informed terms to explain what goes on in the skies above us. So they are walking back offensive or non-inclusive language in scientific communications about nebula and galaxies, by understanding that the words that they've used are inferred with meaning about for some cultures, for women, and understanding that they NASA and other agencies, other sectors need to pay attention to their choice of language. We can see this importance of language in the non-government organisations we work with, paying very special and particular attention to uses of language, so we can, as researchers, inform ourselves by going looking for the types of guidance we're seeing from the community sector, from the non-government sector, and using that to structure and help us make decisions about the writing, the research that we do. Also published in IJDP is an excellent commentary written by colleagues talking about guiding principles for breaking down drug-related stigma in academic writing. I've pulled out a couple of points on these slides here. You're welcome to look at them later on. And these authors give a list of things to always do. And again, I'm not going to spend time on them, but you can go and check them out. They're very useful, and further breakdowns of each of those headings that were on the previous page. So really useful guidance for people who are writing in this sector, particularly for the first time. And I think this is my last slide to think about the subgroups that we might be interested in. So this is, again, published in IJDP, guidance for embracing person-centered language for people in prison and people who are formerly in prison. And I'll just finish on a call from a person who was formerly in prison, Eddie Ellis, who says, when we are not called mad dogs, animals, predators, offenders, and other derogatory terms, we are referred to as inmates, convicts, prisoners, and felons, all terms devoid of humanness, which identify us as things rather than as people. These terms are accepted as the official language of the media, law enforcement, prison industrial complex, and public policy agencies. However, they are no longer acceptable for us, and we are asking people to stop using them. So we're also asking all of our contributors to the conference to think very carefully about the language they use and how they frame these very sensitive areas of drug use, incarceration, gender, and so on. So now I've got the pleasure of handing over to Andrew, who is one of the co-conveners of the conference coming up in Cape Town. Over to you, Andrew.
Great, thank you. I know some people may have joined us a little bit late, so just to recap of what Jason highlighted is sometimes it's useful to take a step back and review on where you are with your research and how you can translate that into an abstract for submission. And for whatever abstract track you're submitting, it's very important to have a very good idea of what component you're submitting on. And so that is being very clear on what the objective or question is that you're going to be reporting on. And also to be clear that you have done the analysis, or you can do the analysis in time for it to be submitted, or you could consider the late breaker. Then make sure that your interpretation of the data that you present aligns with what the data says, and similarly tying together the conclusions that you make, that it is coherent. And that principle applies to the epidemiological data, to the qualitative work, and also when talking about models of care. And then ensuring that if your background, which as Jason said, you don't want to lose the reader, should be very sharp and crisp and relating to what your final core of your abstract is focusing on. So when we're looking at the models of care track, we're interested in understanding how programs in different contexts are being implemented. We're looking for innovation, and we're looking to how this is really working to enhance the healthcare of people who use drugs. So that said, we are also then wanting that change or that impact to be able to be described, either using a quantitative method or a qualitative method, so that the findings can be understood by other people reading the abstract and scoring it. And this could cover aspects of community engagement, healthcare or stakeholder education, or even health promotion. So you'll see it is a quite broad scope. However, we do expect that it's structured, it's rigorous, and that there's some new contribution to knowledge. So someone did ask, perhaps what you're doing is not new globally, but might be new in your context. So what we then challenge you to do is to highlight perhaps what's new or different in your context, and how what you've done might be useful in your context or in countries that might be similar. So we would be looking at all those factors when part of the scoring as the review team. So the guidelines are well written out on the website. You'll see that the background is around why the program or the model of care was done and what were its specific objectives. Be careful when describing the objectives, because they may be very broad, but you may not have enough words to cover all of those findings or results in what you present on your effectiveness section. So you may need to scale down the listed objectives to perhaps only being a portion of what the overarching project aimed to do. We want quite a clear description of the model to understand your interpretation of how it works and why it's innovative. And that might include aspects of who, what, where, and when. And when looking at the effectiveness, that's where we really want to see the data. We understand that it's not always possible to have quantitative data, but if there is qualitative data presented, it must be clear how that qualitative data was obtained. Was it through focus groups, interviews, through content analysis of project documents, or of process evaluation? That is important to give some sense of reliability to the data that's presented, particularly if it's qualitative. The conclusions and next steps really should describe how this model of care will be utilized, and perhaps how it might be applicable in other contexts, because that's really the intention of sharing these models, so that they might be used by others and continue this work. The criteria of scoring is similar to the other ones. It's out of 20, with 5 being excellent and then scored appropriately. And the subheadings of the abstract are the same components that are used for the scoring. So I've just drawn an example here and have wanted to show how the end product should look. And there are important guidance that should be followed. You'll see we ask for the title to be bolded. We ask for all the authors to be listed in the correct order. And we ask that the presenting author is highlighted. And then all of the relevant affiliations are also clear when the submission is made. Then when going on to the background, you'll see again here a clear, sharp, crisp description of the model and what it intended to do, and then description of the analysis and the process. So there's the timing, there's the detail of where, and then there's an overview of the process, some examples of the rapid tests, and what was measured. And you can see how the subheadings are useful for the reviewer, but also when we present these if they go into the conference program, etc. When listing the key results, these have to link very clearly to the methods that were described earlier. So another common pitfall is people may mention methods that are done, but then none of those results are presented. Or similarly, there are results that are presented that it's not clear to the reader how that links to the described methodology. So ensure that that's provided in a clear way. Where appropriate, give proportions, give measures of dispersion, if there are measures of association, or if there are aspects of theory or quotes that need to be included as supporting the qualitative findings, be sure to include those as part of effectiveness data. And then again, the conclusions should clearly link to what the results were and the initial aim as prescribed earlier. It is important that whoever's submitting makes a disclosure of interests. So the practical approach is to use the abbreviation or the acronyms of the author's names and describe the kinds of support that is provided, and also to mention any particular funding. So that is also a requirement for an abstract being submitted. So that's from me. I'm handing back to Emma to facilitate questions and answers that people might have.
Thanks, everyone, and thank you so much to our wonderful presenters. Fantastic. We've been doing a very good job of keeping on top of the questions that are in the chat box. So we don't have anything immediately. If anyone has something that springs to mind, do pop it in. I did just want to draw your attention to some other deadlines. You know, we've mentioned it a few times, but just to reinforce, the deadline for abstract submission is the 2nd of March. You would be notified of the outcome of your abstract the week of the 5th of May. Late breaker abstracts will open on the 12th of May. It's a very short time frame for your abstract deadline. Your late breaker abstract deadline is the beginning of June, and all successful abstracts will be notified of their day and time in the program the 1st or 2nd week of July. Question here from Stephanie. Do the scholarship applications get graded depending on the grade of the abstract result? No. You just need to have an accepted abstract in the program. So the scholarships are all graded against their separate grading criteria, but we do just need an accepted abstract, whether that's at a poster or an oral level. Something else that I wanted to draw your attention to while people are thinking of questions, for anyone who is a student or an early mid-career researcher, there will be a 2-day research writing workshop adjacent to the conference, facilitated by our wonderful speakers who spoke to us today. You'll have a chance to indicate your interest in that workshop during the abstract submission process. Places are very, very limited, but if you are interested, do indicate your interest on that submission process. I can see some hands up. If you do have your hand up, please could you just put your question in the chat? That would be really helpful, and we can make sure that we relay those. Also, if anyone has any questions, you know, if it occurs to you after this webinar, just email us and we can make sure that we collate those in our FAQ document. Jason.
I just wanted to add on what Emma said. about the writing workshop. So as Emma was mentioning, Carla, Andrew, and I are working towards bringing something together. So we're expecting perhaps one or two more of these kind of events that might be linked to that in preparation for that day. So perhaps one on paper writing, which we might do, and might be similar in format, going through a bit of an example and some tips and tricks and then some comments. So stay tuned for that. I'm not sure exactly when we're going to do that, but sometime in the next 3 or 4 months, I imagine, with then perhaps a more in-depth thing. But the idea is for people who want to sort of have papers or want to get to that next stage, and they'll probably be prioritized based on the abstracts submitted. So we're planning on having a couple of days before the conference with a bit of a sort of a writing workshop embedded in. Carla or Andrew, is there anything that you wanted to add to that?
No, well done.
So we are excited, everyone. You know, I think we're really trying to think of ways that we can support you guys, you know, in writing papers and lowering that threshold. And so, you know, I think it'll be a really fun. We've never done it before. So bear with us, but we think it'll be fun for those people who get selected. So yeah. And Stephanie, I'd love to attend the writing workshop. So the workshops will be, so I think you just need to, maybe Emma can elaborate, but you'll be able to apply for it when you register for the conference. Look, we had to like restrict it. So it's going to be for people that are attending the conference in Cape Town. So when you register or submit your abstract, when you submit your abstract or your scholarship application, you'll be able to indicate that you're interested. And look, it's going to be probably limited to 20 to 25 people. So we had to figure out a way to limit it. So likely what it'll be is those people that have abstracts that are accepted, that rank reasonably well, or ones that have promise, we'll be probably selecting those for. So you'd indicate an interest when you apply, when you register or submit your I think it's when you submit your abstract. Is that right, Emma?
Yeah, that's right. So there'll be a checkbox. Are you interested? Yes, no. And then you have to write a short statement on what you're hoping to get out of the workshop. And just to clarify that this will be only open to students and early mid-career researchers. I can see that there's a question there about when scholarship results will be released. Mid-April, everyone will be notified of the scholarship results. Yes, the presentation for anyone who had challenges joining or joined partway through, the full recording and the slides and an FAQ document will be shared next week. So no problem with that. Okay.
There's a question, Emma, from Nikki Palmer about service development initiatives.
Oh, that might be further up for me. Do you see? Okay. Would service development initiatives be appropriate to submit as an abstract? Developing process for evaluating elimination in prisons. Suggest yes, definitely.
The other thing I didn't say this, but please go and have a look at some of the abstracts from last year, from like the 15-minute orals. We gave you a little bit of a snippet of some of the ones, but go and have a look at them. Like if I think about, you know, I've been doing this for a long time, but you know, if I think about how did I learn how to do this stuff, it was all through learning how, like, people who were much better than me at doing this, and I just picked the bits and pieces of stuff that I liked from how people did things. So, you know, look at other abstracts, pick the bits that you like. There's not a one size fits all. Your approach might be a bit different. So, you know, but I would encourage you to look at how other people do it, and again, pick the things that you think are best. Yeah.
But I'd suggest having someone else read your abstract, give you feedback, make sure it's, as I think Jason mentioned, it makes sense to someone who might be coming from a different field, but they need to be able to understand what you've communicated in your abstract.
I can see there's a question here from someone. I've done work around facility readiness for implementing modified simplified Hep C treatment models. Would that fall under the model of care abstract stream? Potentially, yes.
Yeah, so I find that that's the kind of example that could be a good fit. I think if there's a description of what the objective was, how the methodology was implemented, and what your findings were, that is one example that would definitely be applicable. And then there was someone who was asking about one country have different abstracts. So yes, you can submit abstracts, multiple people. You shouldn't be submitting, we didn't mention this, we should have noted you shouldn't submit the exact same abstract to INSU that you've submitted elsewhere. It should be, tailored to the specific conference. Sometimes you have a large project and there are different components, and it's often quite difficult when you're starting to write abstracts to really narrow it down to what I like to think of a publishable unit. And so you could have a big project that might make one paper, but it could actually be 4 different abstracts. So that definitely is something to think about with your colleagues, that there are different people that can then be lead writers of abstracts, and other people can help them develop them and be co-authors.
The one thing I will say, you guys, and not to go against what Andrew said, but just, the one thing I will say about the submitting repeat stuff, the one that, let's just say, I definitely would not, if you submitted an abstract into last year, don't submit the same one to this year's conference. But I think, you got to use a little bit of judgment. Let's say you submitted an abstract to your national conference, and the audience was maybe only the people from that country, and then you submit it to INSU. That's okay. Again, part of this, we want to support knowledge translation, and so we won't be too strict about that. So I think just use a bit of judgment. And again, if you submitted it to a complete infectious disease conference that maybe would have had less sort of drug and alcohol people, then again, it's okay, but disclose it, because there is an opportunity or place to disclose it, and we'll usually be pretty reasonable about that. It's a bit different of, did the person, submit that exact same thing last year, kind of thing. So
there's a few questions here around if you are going to be submitting something on a model of care and your methods and your evaluation is using qualitative methods, would that go under the model of care stream or the social science stream?
Social science. And I think it depends on, look, it's a bit tricky. I think it depends what the thrust of and aims of your abstract are. And I think the issue is, remember Carla's points, and I'll let, if Carla wants to jump in as well, but if it doesn't have a theoretical framework to it, then it potentially might get penalized going into the social sciences. So it might not be high enough bar. Whereas if you're describing your general model of care and there's some social science evidence to back up that model, it might fit better in the model of care section. But I don't know, Carla, if you want to add to that at all.
Yeah, that's exactly what I was going to say. I think if you're looking, like Nadia's comment about the barriers and facilitators of a model of care, I think that might fit best in the model of care stream.
Yeah.
Yes, it would go, you should choose that stream.
Any further questions from anyone?
There's one from about, what if you're not with a registered organization? Do you still have the chance to make it through? I think it depends on the research that's being done and proposed. So we've definitely had situations of, people from the affected community who report on some really impressive health promotion activities that have been done, or health, testing campaigns and whatnot. So I think that, being registered with an organization doesn't it's not the criteria. I think it's more the quality of the information that's being submitted.
Absolutely. Thank you, everyone. I can't see any more questions that have come through. Like I said, we'll be circulating this. Oh, sorry. Is the conference focused on Africa settings or all over the world? It's an international conference, so we encourage abstracts from wherever you are, showcasing work from all over.
You know what? One thing, because I just saw sort of Alex, my good friend and colleague Alex Wade, in Australia, and like, I think that's a perfect example. So, Alex and I have done some work together, and I think I guess advice to people who might be providers, try and maybe seek out a friendly research colleague to get some advice or some help. I know, I've learned a lot from Alex over the years, and we've done some work to try and, submit abstracts together. And again, it's fascinating because even Alex and I, we go, oh, should this go to model of care? Should it go to clinical research? We have those exact same discussions. So don't feel like you don't know. It's not always clear cut. And I think you have these discussions with your colleagues, look at it and weigh things up and be like, oh, okay, maybe this is the best place to go. So don't, and if you have a question, you can reach out and ask the team as well about this. But I think part of this is about trying, and that's one thing that INHSU wants to do, is to help community and help healthcare providers who may be not as research involved to kind of be able to cross over that barrier. And we're hoping to do more of this kind of stuff to facilitate entry into doing research. So yeah, we don't all have all the answers. So enlist, call a friend, and sort it out together, kind of thing. I guess that would be some parting advice.
Absolutely. Look, as a network, we're very supportive and we'll do whatever we can to link you in with anyone who can support you if we can't directly. So do reach out, and thank you all for joining. Thank you to our presenters. Thank you to my colleague Brooke, who's done all the stuff in the background. So thank you all, and we hope to see you